The missing single tooth 1-1 is to be restored with a transversally screw-retained porcelain crown. There's sufficient interocclusal space, and soft tissue management and the gingival emergence profile are favourable following uncomplicated osseointegration of the Straumann implant. For impression taking, the SCS healing cap is removed and the internal threading of the implant is thoroughly cleaned and dried. Then the impression cap is placed on the implant shoulder and snapped firmly into place. The rotation test shows that the impression cap is securely positioned. Next, the positioning cylinder is aligned inside the impression coping and inserted as far as it will go. There should be no gaps between the impression coping and the positioning cylinder. The impression is taken using a custom impression tray and an elastomeric impression material. This is the completed impression with the impression coping and positioning cylinder in place. The implant is now once again closed using the SCS healing cap and the temporary restoration is inserted. At the dental laboratory, the corresponding implant analog is repositioned in the impression. The shoulder must snap firmly in place. A gingival mask should always be used to achieve an optimal cervical crown contour. The working model is created as usual using dental stone. This is the completed working model with the implant analog and the gingival mask. After checking the clinical situation on an articulator, the abutment can now be selected. For this purpose, a special prosthetic planning kit is available to dental technicians to facilitate the choice of the correct components and to keep inventory levels at a minimum. This planning kit includes plastic try-in abutments for crowns and bridges that can be placed on the implant analogs to verify their heights and axial inclinations. The RN synOcta transversal abutment is placed on the RN synOcta analog and aligned inside the octagon. The screw is manually tightened using the SCS screwdriver. A total of 16 different positions are available for the transversal opening. After positioning, the RN synOcta TS plastic coping is placed on the abutment and a transversal screw is used with a hexagonal TS screwdriver to loosely attach it. The interocclusal relations are checked and the crown framework is waxed up according to standard porcelain fused to metal procedures. The application of graphite to the threading of the thread protection screw and of the cap is important. This ensures that the thread protection screw is easily removed after casting. Next, the modelled crown is invested. This is the completed cast crown framework. The construction can be placed on the working cast without any tension at all. The interocclusal space is sufficient as well. casting is veneered with ceramic material following anatomical guidelines. The completed crown is first retained on the working cast with the transversal screw, and the occlusion and articulation are checked. To ensure a correct transfer of the position of the RN synOcta transversal abutment from the working cast to the patient in the dental office, a prefabricated transfer aid can be used. It's made of plastic, can be attached by polymerization, and is simply slid onto the RN synOcta transversal abutment. A transfer index is created on the working cast in order to transfer the abutment to its precise position on the implant in the mouth. The healing cap is removed from the implant at chairside, and the interior of the implant is thoroughly cleaned. Using the transfer index, the RN synOcta transversal abutment is precisely replaced on the implant and manually tightened using the SCS screwdriver. The base screw is definitely tightened to a torque of 35 Newton centimeters. Once this is done, the crown fits easily and exactly on the abutment and can be manually screwed in place palatally in a transverse direction using the TS hexagonal screwdriver. The follow-up radiograph shows that the implant is positioned according to the intended long axis and that the crown is placed on the implant shoulder with no marginal gap whatsoever. Transversal screw retention can be used wherever an occlusal or incisal screw cannot be used for aesthetic, design or functional purposes.